So this video is to introduce you to what to expect when you attend either of our emergency departments at Pinderfields or Dewsbury hospitals. We are open 24 hours a day, 7 days a week, and we're here to manage severe or potentially life-threatening conditions. We would like to remind you to only attend if you have a true medical emergency. A true medical emergency are things such as a loss of consciousness, fitting which doesn't stop within a few moments, severe or persistent chest pain, breathing difficulties whereby you may not be able to hold a conversation with somebody, or significant bleeding which cannot be stopped by first aid means. You may also suffer an injury which would be serious or potentially life or limb threatening, and these may include things like burns and scalds. In order to protect our patients and staff and to support social distancing, it is no longer possible for family or friends to wait with patients whilst they're in the department. Exceptions are made for patients under the age of 18 and those who are critically unwell or marked as vulnerable. When inside any of our hospital buildings, you must wear a face covering. Please ensure you adhere to social distancing measures, keeping 2 meters apart from others where possible. At the reception desk, you will be asked for your name and to briefly outline the reason for your visit. If you think you may have coronavirus, phone NHS 111 before coming to the emergency department, as you may not need to attend. If you visit our emergency department with symptoms that may be caused by COVID, you will be seen in a dedicated COVID area within the department to ensure we can protect all our patients. Patients visiting who have recently returned from countries not on the UK travel corridor list and who are still in the quarantine period will also be seen through this route. Once you've been registered, you will be asked to take a seat in the relevant waiting area until you are called for your assessment. Do not sit next to anyone else. Seats are clearly marked. You will need to keep your face covering on at all times. Patients are seen in time order wherever possible, but critically unwell patients will be prioritised, and less severe cases are likely to wait longer when the department is dealing with large numbers of very sick patients. Due to COVID-19, some of our patients are having to wait longer to be seen with non-emergency conditions. You can telephone NHS 111 before you come to the emergency department, and they will help you with alternatives. Patients attending the department with an illness are first seen by one of our nurses for an assessment. The nurse will run some simple observations and ask you a few questions. What happens next depends on the results of your assessment. Sometimes further tests need to be arranged before a course of action can be decided. You will be asked to wait in the waiting area again until a decision is made, generally after your investigation results are available. We would ask those people who do not have a true medical emergency to contact the NHS 111 service before turning up at our departments. Please remember there are other services available to use, such as the Urgent Treatment Centre at Pontefract, the walk-in centres, and NHS 111 will direct you appropriately. The emergency department is not a replacement for your GP appointment.